Welcome back to our health and wellness series. Today we are diving into the world of pain relief and exploring the age-old question, Aleve versus Advil. Which one should you choose when it comes to finding relief from those pesky aches and pains? In this video, we'll be comparing these two popular over-the-counter medications to help you make an informed decision. So, let's get started. Before we delve into the differences between Aleve and Advil, let's take a moment to understand the basics of these medications. Both Aleve and Advil belong to a class of drugs called non-steroidal anti-inflammatory drugs, or NSAIDs for short. These medications are commonly used to alleviate pain, reduce inflammation, and lower fevers. One of the key differences between Aleve and Advil lies in their active ingredients. Aleve's active ingredient is naproxen sodium, while Advil's active ingredient is ibuprofen. Both drugs work by inhibiting the production of certain chemicals in the body that cause inflammation and pain. When it comes to duration of action, Aleve tends to have a longer lasting effect compared to Advil. Aleve provides relief for up to 12 hours, while Advil typically offers relief for around 4 to 6 hours. This difference in duration may make Aleve a more suitable option for those seeking longer-lasting pain relief. Both Aleve and Advil are effective in providing pain relief, but certain factors may influence their efficacy for different individuals. Some studies suggest that Aleve may be more effective in treating certain types of pain such as muscle aches and menstrual cramps, while Advil may be more effective in relieving headaches and fever. It's important to consider your specific needs and consult with a healthcare professional for personalized advice. Like any medication, both Aleve and Advil carry potential side effects and safety considerations. Common side effects of both drugs may include stomach upset, heartburn, and dizziness. However, Aleve may have a slightly high risk of gastrointestinal issues, including ulcers and bleeding, particularly with longer-term or high-dose use. It's crucial to follow the recommended doses and consult your doctor if you have any underlying health conditions or are talking about medications. Certain individuals may need to take special precautions or avoid specific medications altogether. For example, individuals with a history of stomach ulcers, kidney disease, or heart conditions should exercise caution when using Aleve or Advil. Additionally, pregnant women or those breastfeeding should consult their healthcare provider before taking these medications. Always read the label and follow the instructions provided. Lastly, let's touch on the cost and accessibility of Aleve and Advil. Both medications are widely available over the counter and can be found in most pharmacies, grocery stores, and online retailers. In terms of pricing, there might be slight variations depending on the location and store, but generally, these medications are fairly affordable and accessible options for pain relief. So after comparing Aleve and Advil, it's clear that they have similarities and differences that may influence your choice. Aleve provides longer-lasting relief, while Advil offers a shorter duration of action. The choice between the two may also depend on the specific type of pain you are experiencing. Aleve may be more effective for muscle aches and menstrual cramps, while Advil may be better suited for headaches and fever. However, it's important to remember that individual responses to medications can vary. What works well for one person may not work as effectively for another. It's always a good idea to consult with your healthcare professional before starting any new medication to ensure it's the right choice for you. When it comes to safety and side effects, both Aleve and Advil carry some risks. Stomach upset, heartburn, and dizziness are common side effects associated with these medications. Aleve may have a slightly high risk of gastrointestinal issues such as ulcers and bleeding, especially with long-term or high-dose use. It's crucial to follow the recommended doses and duration of use and to seek medical advice if you have any concerns or underlying health conditions. Special considerations should also be taken into account. Individuals with a history of stomach ulcers, kidney disease, or heart conditions should be cautious when using Aleve or Advil. Pregnant women or those breastfeeding should consult their healthcare provider before taking these medications to ensure the safety of themselves and their baby. In terms of cost and accessibility, both Aleve and Advil are widely available over the counter. They can be found in pharmacies, grocery stores, and online retailers. The pricing may vary slightly depending on the location and store, but generally, these medications are affordable and easily accessible options for pain relief. To summarize, when choosing between Aleve and Advil for pain relief, consider the duration of action, your specific type of pain, safety considerations, and individual factors such as underlying health considerations. Remember to follow the recommended doses, consult with a healthcare professional if needed, and prioritize your overall well-being. Thank you for joining us today as we explored the topic of Aleve versus Advil. We hope this information has been helpful in making an informed decision about which medication may be best suited for your pain relief needs. Take care, and we'll see you next time.